Pneumonia and COVID-19 relationship. Pneumonia is a severe lung infection. In some people, it can be fatal, especially among the elderly and those with respiratory disorders. COVID-19, the disease the novel coronavirus causes, can spread to the lungs, causing pneumonia. While many people recover, some develop severe pneumonia that does not respond well to treatment. In this video, we look at the relationship between COVID-19 and pneumonia, the treatment available and precautions a person should take. What is the relationship? According to the Centers for Disease Control and Prevention (CDC), COVID-19 is a respiratory illness. A person may have a dry cough, fever, muscle aches, and fatigue. The virus can progress through the respiratory tract and into a person's lungs. This causes inflammation and the air sacs or alveoli that can fill with fluid and pus. This progression then limits a person's ability to take in oxygen. People with severe cases of pneumonia may have lungs that are so inflamed they cannot take in enough oxygen or expel enough carbon dioxide. Continuous oxygen deprivation can damage many of the body's organs, causing kidney failure, heart failure, and other life-threatening conditions. According to the World Health Organization, the most common diagnosis for severe COVID-19 is severe pneumonia. For people who do develop symptoms in the lungs, COVID-19 may be life-threatening. In China, doctors classified 81% of COVID-19 cases as mild. These mild infections include mild cases of pneumonia. The remaining 19% of cases are more severe. How does COVID-19 affect the lungs? People with COVID-19 pneumonia experience changes in their lungs, including inflammation that may be so severe it damages the lungs alveoli, fluid accumulation in the lungs, gas exchange difficulties that make it hard to get enough oxygen or expel enough carbon dioxide, fluid leaking out of blood vessels in the lungs. Symptoms of pneumonia. The symptoms of pneumonia can vary from mild to severe. However, typical symptoms include coughing, loss of appetite, nausea, vomiting, shortness of breath, fever, difficulty breathing deeply. Pneumonia is severe when a person is having difficulty breathing and experiences respiratory distress. Who is most at risk of COVID-19 pneumonia? People with conditions that weaken the lungs or immune system may be more vulnerable to COVID-19 pneumonia. Those conditions include cancer, diabetes, high blood pressure, severe heart disease, kidney or liver disease, asthma, and other breathing disorders. Additionally, people over 65 years of age have a much higher risk. How do doctors diagnose pneumonia? To diagnose pneumonia, doctors typically perform imaging scans to look for swelling, inflammation, or fluid in the lungs, although sometimes a diagnosis is possible without any imaging. CT scans can diagnose pneumonia, though some doctors may recommend an X-ray or another type of scan. To test for COVID-19, doctors can take a swab from the nose and the mouth. Treatment for COVID-19 pneumonia. According to the CDC, inpatient care for those with severe cases of COVID-19 typically focuses on managing the complications. If a doctor suspects that a person is experiencing pneumonia, they may prescribe antibiotics, even though this will not treat COVID-19. People with more severe pneumonia may need to stay in the hospital, While in the hospital, a person may receive intravenous fluids and monitoring. People with breathing difficulties may need a ventilator or oxygen therapy. Precautions to take. To avoid contracting the coronavirus or transmitting it to someone else, a person should avoid contact. They should avoid contact with people outside their own household as much as possible. When contact is unavoidable, they should maintain a safe 6 feet distance from other people. They must also avoid physical contact with others, including shaking hands. Wash hands frequently. Do so by using soap and warm water. Not go outside. Remain at home and do not go out into public places if sick. People who have or believe they have COVID-19 should take the following additional precautions. Avoid other people, including those in the same home. Wear a face covering when around other people. Isolate in a single room and when using the bathroom to avoid spreading germs. Do not share personal care products. Practice good self-care by getting plenty of rest, eating regularly and drinking lots of fluids. Call a doctor if symptoms are severe. Does the pneumonia vaccine prevent COVID-19 pneumonia? According to the World Health Organization, the pneumonia vaccine does not protect against the new coronavirus. As yet, there is no vaccine for COVID-19 either. Vaccines for pneumonia only prevent certain types of pneumonia such as pneumococcal pneumonia. However, these immunizations may help prevent other serious illnesses, including infections a person may contract while in hospital. When to see a doctor? There is no cure for COVID-19 at the current time. Treatment focuses instead on managing symptoms. People who think they have COVID-19 do not need to see a doctor for testing or treatment unless they are severely ill. People who become severely ill should call a doctor ahead of time to reduce the risk of spreading the disease to others. People who cannot breathe or who feel chest tightness or other serious symptoms such as shortness of breath or a blue tinge to the lips should call for emergency treatment.